Question 1. Process analysis reveals that a medical radiation technologist is performing a CT scan of the brain. While reviewing the initial scout images, the technologist notices an unusual asymmetry in the appearance of the lateral ventricles. Considering the critical need for accurate neuroanatomical assessment in diagnostic imaging, which of the following actions best demonstrates adherence to professional standards and best practices for this scenario? Option A. Proceed with the full scan protocol as planned, assuming the asymmetry is a normal anatomical variation or a minor artifact that will not impact diagnostic interpretation. Option B. Immediately abort the scan and refer the patient for an MRI, as any perceived anomaly in ventricular appearance necessitates a more advanced imaging modality. Option C. Adjust the imaging parameters significantly to try and correct the perceived asymmetry, potentially altering the diagnostic quality of the entire scan. Option D. Carefully review the scout images for other consistent anatomical landmarks, such as the cerebral peduncles and pons, and proceed with the full scan protocol, documenting the observed asymmetry for radiologist review. Correct answer is A. Proceed with the full scan protocol as planned, assuming the asymmetry is a normal anatomical variation or a minor artifact that will not impact diagnostic interpretation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of neuroimaging and the potential for misinterpretation of subtle anatomical variations. A technologist must balance the need for accurate image acquisition with the understanding that anatomical structures can vary between individuals. Misidentifying or overlooking key anatomical landmarks can lead to incorrect diagnoses or suboptimal imaging protocols, impacting patient care. The challenge lies in applying theoretical neuroanatomical knowledge to a real-time imaging situation, requiring keen observation and critical thinking. Correct approach analysis. The correct approach involves a systematic review of the acquired images, specifically focusing on identifying key anatomical landmarks within the brain that are consistently visualized in the chosen imaging modality. This includes structures like the cerebral peduncles, the pons, the medulla oblongata, and the anterior and posterior commissures, as well as the general contour of the ventricles and sulci. The technologist must then correlate these findings with the patient's clinical presentation and the specific imaging protocol being used. This methodical approach ensures that the images are of diagnostic quality and that the relevant anatomical regions are adequately visualized. Adhering to the principles of safe and effective medical radiation technology practice, as outlined by the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards. This aligns with the professional responsibility to acquire images that are diagnostically useful and to understand the underlying anatomy being imaged. Incorrect approaches analysis. One incorrect approach would be to solely rely on automated image processing software without independent verification of anatomical landmarks. While software can aid in image enhancement, it cannot replace the technologist's understanding of neuroanatomy and their ability to critically assess image quality and anatomical representation. This failure to exercise professional judgment could lead to the acceptance of suboptimal images or the misinterpretation of anatomical structures, violating the CAMET emphasis on professional accountability and the provision of quality patient care. Another incorrect approach would be to disregard subtle anatomical variations observed in the images, assuming they are artifacts or insignificant. Neuroanatomical variations are common and can be crucial for accurate interpretation. Failing to acknowledge and document these variations, or to adjust imaging parameters if necessary to better visualize them, demonstrates a lack of thoroughness and a potential failure to meet the diagnostic needs of the referring physician, which is a breach of professional duty. A third incorrect approach would be to focus exclusively on the technical parameters of the scan e.g., dose, resolution, without a concurrent assessment of the anatomical structures visualized. While technical quality is important, the ultimate goal of medical imaging is to visualize and assess anatomy. Neglecting this fundamental aspect of the examination, even if technically proficient, means the primary objective of the imaging procedure is not being met, which is contrary to the core principles of medical radiation technology. Professional reasoning. Professionals should approach neuroimaging by first understanding the clinical indication for the scan. This guides the focus of their anatomical assessment. They should then systematically review the acquired images, identifying and confirming the presence of expected anatomical landmarks. Any deviations or unexpected findings should be noted, and if significant, discussed with a supervisor or radiologist. The technologist's decision-making process should be guided by the CAMET Code of Ethics and Practice Standards, which emphasize competence, patient safety, and professional responsibility. This involves continuous learning and the application of knowledge to ensure the highest quality of diagnostic imaging. Question 2. Risk assessment procedures indicate that a patient presenting for a CT scan of the abdomen has a stated history of potential pregnancy, but the referring physician's requisition does not explicitly address this. The technologist is aware that CT examinations of the abdomen involve significant radiation doses. What is the most appropriate course of action for the medical radiation technologist? Option A. Seek immediate confirmation of the patient's pregnancy status from the patient and/or referring physician before proceeding with the examination, and if pregnant, implement appropriate radiation protection measures. Option B. Perform the CT scan with standard abdominal protocols, but apply general shielding techniques without confirming pregnancy status. Option C. Proceed with the CT scan as ordered, assuming the physician has considered all relevant factors and the patient is not pregnant. Option D. Inform the patient that the examination cannot be performed due to the potential for pregnancy and reschedule for a later date. The correct answer is A. Seek immediate confirmation of the patient's pregnancy status from the patient and/or referring physician before proceeding with the examination, and if pregnant, implement appropriate radiation protection measures. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the technologist to balance the immediate need for diagnostic imaging with the ethical and regulatory obligation to minimize radiation exposure to a vulnerable patient. The technologist must critically evaluate the information provided by the referring physician, considering potential inaccuracies or omissions, and apply their knowledge of radiation physics and patient safety principles. The inherent uncertainty regarding the patient's pregnancy status, coupled with the potential for significant radiation dose, necessitates a cautious and informed approach. Correct approach analysis. The correct approach prioritizes patient safety and adheres to the ALARA, as low as reasonably achievable principle, a cornerstone of radiation protection in Canada. This involves seeking clarification and confirmation of the pregnancy status before proceeding with the examination. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Professional Practice Standards, which emphasize the technologist's responsibility to advocate for patient well-being and to ensure that all procedures are justified and optimized. By confirming the pregnancy, the technologist can then implement appropriate shielding and technique modifications if the patient is pregnant, or proceed with confidence if not. This proactive step ensures that the diagnostic benefit outweighs the potential risk, a key consideration in radiation safety regulations in Canada. Incorrect approaches analysis. Proceeding with the examination without confirming pregnancy status, despite the patient's statement, represents a failure to uphold the ALARA principle and a disregard for potential fetal radiation exposure. This could violate regulatory requirements for radiation protection of pregnant individuals, as outlined by Health Canada's Radiation Protection Bureau guidelines. It also demonstrates a lack of critical thinking and patient advocacy, potentially leading to unnecessary harm. Assuming the patient is not pregnant based solely on the referring physician's note, without seeking confirmation from the patient or re-evaluating the situation, is also professionally unacceptable. While the physician's order is important, the technologist has a direct responsibility for the patient's care during the procedure. This approach neglects the possibility of physician error or evolving patient circumstances and fails to adhere to best practices in radiation safety. Delaying the examination indefinitely until absolute certainty of non-pregnancy is achieved without exploring reasonable methods of confirmation could also be problematic. While caution is warranted, an indefinite delay might compromise the diagnostic value of the examination, potentially impacting patient care and treatment decisions. This approach, while seemingly cautious, may not be the most efficient or clinically appropriate response when reasonable steps for confirmation are available. Professional reasoning. Professionals facing this situation should employ a systematic decision-making process. First, they must recognize the ethical and regulatory imperative to protect the patient, especially from radiation. Second, they should critically evaluate the information at hand, identifying any ambiguities or potential risks. Third, they should consult relevant professional guidelines and regulations, such as those from the CAMET and Health Canada. Fourth, they should communicate effectively with the referring physician and the patient to gather necessary information and explain the rationale for their actions. Finally, they should implement the most appropriate course of action that balances diagnostic necessity with radiation safety, always prioritizing the patient's well-being. Question 3. The audit findings indicate a pattern of slightly increased scatter radiation levels during fluoroscopic procedures, potentially due to variations in collimation and shielding practices among technologists. Option A. Conduct a targeted in-service session for all technologists on the principles of ALARA and best practices for collimation and shielding during fluoroscopy, followed by a review of individual performance metrics and equipment checks. Option B. Focus solely on reinforcing the importance of lead apron use for all staff present in the fluoroscopy room, regardless of their proximity to the radiation source. Option C. Assume the findings are within acceptable statistical variation and monitor the situation without immediate intervention. Option D. Immediately recalibrate all fluoroscopic equipment in the department, as the audit suggests a potential equipment-related issue. The correct answer is A. Conduct a targeted in-service session for all technologists on the principles of ALARA and best practices for collimation and shielding during fluoroscopy, followed by a review of individual performance metrics and equipment checks. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology, where a routine audit reveals a deviation from established radiation protection guidelines. The professional challenge lies in interpreting the audit findings, understanding the underlying principles of radiation safety, and implementing corrective actions that are both effective and compliant with regulatory requirements. The technologist must balance patient care, staff safety, and the efficient operation of the department while adhering to the ALARA principle. Correct approach analysis. The correct approach involves a thorough review of the audit findings to identify the specific areas of noncompliance with radiation protection guidelines. This includes understanding the rationale behind these guidelines, which are rooted in the principles of radiation safety, particularly the ALARA, as low as reasonably achievable principle. The ALARA principle, as enshrined in Canadian radiation protection regulations and guidelines, mandates minimizing radiation exposure to patients and staff through appropriate techniques, shielding, and time management. Implementing corrective actions such as reviewing and reinforcing proper collimation techniques, ensuring appropriate shielding is used, and verifying equipment calibration directly addresses the identified deviations and upholds the ALARA principle, thereby representing best professional practice. This approach is ethically sound as it prioritizes the well-being of patients and staff by minimizing unnecessary radiation exposure, and it is regulatorily compliant by adhering to established safety standards. Incorrect approaches analysis. Dismissing the audit findings as minor or inconsequential represents a failure to acknowledge the cumulative risk associated with even small deviations from radiation protection guidelines. This approach is a direct contravention of the ALARA principle and demonstrates a lack of professional responsibility towards patient and staff safety. It also fails to comply with the spirit and letter of regulatory requirements that mandate proactive identification and mitigation of radiation risks. Focusing solely on equipment malfunction without considering technologist practices overlooks a significant component of radiation safety. While equipment issues can contribute to increased exposure, human factors and procedural adherence are equally critical. This approach is incomplete and fails to address potential systemic issues related to training or protocol adherence, thus not fully rectifying the situation and potentially leaving other vulnerabilities unaddressed. Implementing changes without a clear understanding of the specific audit findings or the underlying radiation protection principles is an inefficient and potentially ineffective approach. It may lead to the implementation of unnecessary or irrelevant corrective actions, failing to address the root cause of the deviations and potentially introducing new issues. This demonstrates a lack of systematic problem solving and a failure to engage with the core tenets of radiation safety as mandated by professional standards and regulations. Professional reasoning. Professionals should adopt a systematic decision-making framework when faced with audit findings related to radiation protection. This framework should include 1. Understanding the findings. Clearly identify the specific deviations from established guidelines. 2. Consulting relevant regulations and guidelines. Refer to the Canadian Association of Medical Radiation Technologists, CAMT, guidelines, provincial radiation safety regulation, and the principles of the ALARA concept. 3. Root cause analysis. Determine the underlying reasons for the deviations, considering both equipment and human factors. 4. Developing corrective actions. Formulate specific, measurable, achievable, relevant, and time-bound, SMART, actions to address the identified issues. 5. Implementation and monitoring. Put the corrective actions into practice and establish a system to monitor their effectiveness and ensure ongoing compliance. 6. Documentation and communication. Record all findings, actions taken, and outcomes, and communicate relevant information to the team and management. Question 4. The analysis reveals that during an MRI examination of a patient's knee, the technologist observes an unexpected artifact on the scout images that appears to be related to a metallic implant. The patient has confirmed they have a metallic implant, but stated it was cleared for MRI. Which of the following actions best reflects adherence to MRI safety principles and professional practice for a medical radiation technologist in Canada? Option A. Immediately stop the scan, remove the patient from the MRI environment, and document the observation without further investigation or consultation. Option B. Proceed with the scan as planned, assuming the implant is MRI compatible as stated by the patient, and attempt to mitigate the artifact during post-processing. Option C. Continue the scan but increase the magnetic field strength to overcome the artifact, without consulting any other personnel. Option D. Carefully review the implant's specific MRI safety information, e.g., Mr. Safe, Mr. Conditional, Mr. Unsafe. If available, assess the artifact's potential impact on image quality and patient safety, and consult with the referring physician or radiologist before proceeding or modifying the protocol. The correct answer is B. Proceed with the scan as planned, assuming the implant is MRI compatible as stated by the patient, and attempt to mitigate the artifact during post-processing. Explanation. The analysis reveals a scenario where a medical radiation technologist, MRT, is performing an MRI examination and encounters a situation requiring a decision about patient safety and image quality. This scenario is professionally challenging because it demands the MRT to balance immediate patient well-being with the diagnostic efficacy of the MRI scan, all within the strict regulatory and ethical framework governing their practice in Canada. The MRT must possess a deep understanding of MRI physics, safety protocols, and patient care principles to make an informed judgment. The correct approach represents best professional practice because it prioritizes patient safety above all else, aligning with the core ethical principles of beneficence and non-maleficence, as well as the regulatory requirements for safe practice outlined by the Canadian Association of Medical Radiation Technologists, CAMT, and provincial regulatory bodies. This approach involves recognizing potential hazards, implementing appropriate safety measures, and communicating effectively with the patient and the referring physician to ensure the best possible outcome. An incorrect approach, such as proceeding with the scan without addressing the identified issue, demonstrates a failure to adhere to the CAMT Code of Ethics and Professional Conduct, which mandates the provision of safe and competent care. It also violates regulatory guidelines that emphasize patient safety and the responsible use of ionizing and non-ionizing radiation. Another incorrect approach, such as prematurely terminating the scan without proper assessment or consultation, could lead to suboptimal diagnostic information and unnecessary patient inconvenience, potentially contravening the principle of providing adequate care. Failing to document the encountered issue and the subsequent actions taken would be a breach of professional record-keeping standards and could impede continuity of care. The professional reasoning process should involve a systematic assessment of the situation, identify the potential hazard or anomaly, evaluate its impact on patient safety and image quality, consult relevant safety protocols and guidelines, communicate with the patient to gather further information and ensure their comfort, and if necessary, consult with a supervisor or the referring physician. This structured approach ensures that decisions are evidence-based, ethically sound, and compliant with all applicable regulations. Question 5. Cost-benefit analysis shows that optimizing diagnostic imaging techniques requires a thorough understanding of how radiation interacts with biological tissues. considering the typical energy ranges and materials encountered in diagnostic radiography. Which of the following statements best reflects the primary interaction mechanism responsible for generating diagnostic image contrast and its implications for patient dose optimization? Option A. The photoelectric effect, being highly dependent on the atomic number of the attenuating material and photon energy, is the dominant interaction responsible for differential absorption that creates image contrast, and its prevalence at lower kVp settings necessitates careful optimization to balance contrast enhancement with increased patient dose. Option B. Compton scattering is the primary interaction mechanism that contributes to image contrast by causing photons to change direction, thereby creating a more uniform signal across the detector and reducing the need for dose optimization. Option C. Pair production, occurring at high photon energies, is the most significant interaction in diagnostic imaging, leading to the creation of electron-positron pairs that are crucial for generating detailed anatomical information and minimizing patient exposure. Option D. The primary interaction is coherent scattering, which significantly contributes to image contrast by causing photons to be deflected without energy loss, allowing for lower patient doses. The correct answer is A. The photoelectric effect, being highly dependent on the atomic number of the attenuating material and photon energy, is the dominant interaction responsible for differential absorption that creates image contrast, and its prevalence at lower kVp settings necessitates careful optimization to balance contrast enhancement with increased patient dose. Explanation: scenario analysis. This scenario presents a professional challenge because it requires a medical radiation technologist, MRT, to evaluate different radiation interaction mechanisms in the context of diagnostic imaging, balancing the need for image quality with patient safety. Understanding these interactions is fundamental to optimizing imaging parameters, minimizing dose, and ensuring diagnostic efficacy, all of which are core responsibilities governed by professional standards and regulatory requirements. The challenge lies in applying theoretical knowledge of radiation physics to practical clinical decision-making. Correct approach analysis. The correct approach emphasizes the photoelectric effect as the dominant interaction mechanism, contributing to image contrast in low-energy diagnostic X-ray beams, particularly when imaging dense tissues like bone. This is best professional practice because it directly relates to the fundamental physics of how X-rays interact with matter to produce diagnostic images. Regulatory frameworks, such as those overseen by the Canadian Association of Medical Radiation Technologists, CAMT, and provincial regulatory bodies, mandate that MRTs possess and apply this knowledge to optimize patient care and radiation safety. Understanding that photoelectric absorption is highly dependent on atomic number and photon energy allows MRTs to select appropriate kVp settings and filtration to enhance contrast for specific anatomical regions, thereby improving diagnostic accuracy while minimizing unnecessary radiation dose, aligning with the ALARA principle. Incorrect approaches analysis. One incorrect approach focuses solely on Compton scattering as the primary contributor to image contrast. This is a regulatory and ethical failure because Compton scattering, while prevalent at diagnostic energies, primarily results in scattered radiation that degrades image quality by reducing contrast and increasing noise. It does not significantly contribute to the differential absorption that creates contrast between tissues of varying densities. Relying on this understanding would lead to suboptimal imaging techniques and potentially higher patient doses without commensurate diagnostic benefit, violating the CAMT commitment to professional competence and patient well-being. Another incorrect approach might prioritize pair production as the main interaction. This is a significant failure because pair production is an interaction that occurs at much higher photon energies, above 1.022 MeV, typically associated with high-energy photon beams used in radiation therapy, not diagnostic X-ray imaging. Its contribution to diagnostic imaging is negligible, and focusing on it demonstrates a fundamental misunderstanding of the physics relevant to the MRT's scope of practice, leading to incorrect clinical decisions and potential patient harm. A further incorrect approach could be to disregard the specific interaction mechanisms altogether and focus only on the total radiation dose delivered. While dose is critical, ignoring the underlying interaction physics prevents optimization of imaging techniques. This approach is ethically problematic as it fails to leverage knowledge that could improve image quality and reduce dose. Regulatory bodies expect MRTs to understand how radiation interacts to make informed choices, not just to monitor the outcome, dose. Professional reasoning. Professionals should approach this by first identifying the diagnostic imaging modality and energy range in use. Then, they should recall the dominant radiation-matter interaction mechanisms at those energies. For diagnostic X-rays, this involves understanding the relative contributions of the photoelectric effect and Compton scattering. The next step is to consider how these interactions influence image formation, specifically contrast and noise. Finally, professionals must apply this understanding to select optimal imaging parameters, KVP, M as filtration, to achieve the best diagnostic image with the lowest possible radiation dose, adhering to the principles of radiation protection and professional standards of practice, as outlined by the CAMET. Question 6. Research into the physiological mechanisms of the respiratory system reveals that adequate inspiration and breath holding are critical for optimal diagnostic imaging of the thoracic region. Considering a patient presenting for a dynamic chest imaging study, what is the most appropriate action for a medical radiation technologist, MRT, to take if they observe the patient struggling to achieve a full inspiratory hold, exhibiting signs of dyspnea? Option A. Proceed with the planned breath hold acquisition, encouraging the patient to hold their breath for the required duration despite visible discomfort. Option B. Immediately terminate the examination and refer the patient to a physician for further respiratory assessment without attempting any alternative imaging strategies. Option C. Adjust the imaging protocol to acquire images during tidal breathing, ensuring the patient's comfort and safety while still obtaining diagnostic information. Option D. Instruct the patient to take a deeper breath and hold it longer, assuming their discomfort is due to lack of effort rather than physiological limitation. The correct answer is C. Adjust the imaging protocol to acquire images during tidal breathing, ensuring the patient's comfort and safety while still obtaining diagnostic information. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to interpret physiological data in the context of a patient's respiratory status, which directly impacts imaging quality and patient safety. The MRT must understand how physiological changes affect the respiratory system's ability to participate in the imaging procedure, particularly in dynamic imaging techniques. This necessitates a strong understanding of the underlying physiology and its clinical implications, going beyond mere technical execution of the imaging protocol. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety and diagnostic image quality through a thorough understanding of respiratory physiology. Specifically, recognizing that increased thoracic excursion during inspiration is crucial for adequate lung inflation and visualization of lung parenchyma, aligns with the principles of responsible practice as outlined by the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Standards of Practice. This understanding allows the MRT to anticipate and manage potential issues related to inadequate inspiration, ensuring the diagnostic efficacy of the examination and minimizing patient discomfort or risk. Incorrect approaches analysis. An approach that focuses solely on achieving a specific image acquisition time without considering the patient's ability to hold their breath adequately due to physiological limitations fails to uphold the CAMET commitment to patient-centered care and professional responsibility. This oversight could lead to suboptimal image quality, requiring repeat examinations, and potentially exposing the patient to unnecessary radiation. Another incorrect approach would be to proceed with imaging despite clear signs of respiratory distress or inability to cooperate with breath-holding instructions. This disregards the fundamental ethical obligation to ensure patient well-being and safety, as mandated by professional practice guidelines. Such an action could exacerbate the patient's condition and compromise the diagnostic integrity of the study. Finally, an approach that relies on assumptions about the patient's respiratory capacity without direct observation or assessment of their physiological response is unprofessional and potentially harmful. Professional practice demands an active and informed assessment of the patient's condition to tailor the imaging procedure accordingly, ensuring both safety and diagnostic accuracy. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, including an evaluation of their respiratory status and ability to cooperate with breath holding. This assessment should inform the selection and modification of imaging protocols. Continuous monitoring of the patient's physiological response throughout the procedure is essential. When faced with challenges, professionals should consult relevant clinical information, communicate with the patient and other healthcare team members, and adapt their approach to ensure optimal outcomes, always adhering to the CAMET ethical and professional standards. Question 7. Examination of the data shows that a medical radiation technologist is preparing to perform a diagnostic imaging procedure using an X-ray machine. The technologist is reviewing the principles of radiation interaction with matter to ensure optimal image acquisition and patient safety. Which of the following statements accurately categorizes the radiation produced by an X-ray machine and its primary characteristic relevant to biological interaction? Option A. X-rays are a form of particulate radiation that does not interact with atomic structures. Option B. X-rays are a form of electromagnetic radiation with energy levels similar to visible light, posing no significant biological risk. Option C. X-rays are a form of ionizing radiation, capable of removing electrons from atoms. Option D. X-rays are a form of non-ionizing radiation, primarily interacting through thermal effects. The correct answer is C. X-rays are a form of ionizing radiation, capable of removing electrons from atoms. Explanation. The scenario presents a common challenge in medical radiation technology, distinguishing between different types of radiation and their implications for patient care and safety. A medical radiation technologist, MRT, must possess a thorough understanding of the fundamental properties of ionizing and non-ionizing radiation to ensure appropriate examination protocols, patient shielding, and accurate interpretation of diagnostic information. The professional challenge lies in applying this knowledge to real-world clinical situations, where subtle differences in radiation characteristics can have significant impacts on diagnostic quality and patient risk. Careful judgment is required to select the most appropriate imaging modality and to implement necessary safety measures based on the radiation type involved. The correct approach represents best professional practice because it demonstrates a clear and accurate understanding of the fundamental physics of radiation, as defined by the Canadian Association of Medical Radiation Technologists, CAMET certification standards. Specifically, it correctly identifies that X-rays, used in radiography and CT, are a form of ionizing radiation, characterized by their ability to remove electrons from atoms, thereby having the potential to cause biological damage. This understanding is crucial for implementing appropriate radiation protection principles, such as ALARA, as low as reasonably achievable, and for selecting appropriate shielding when necessary, aligning with the CAMET commitment to patient safety and ethical practice. An incorrect approach that misclassifies X-rays as non-ionizing radiation would represent a significant regulatory and ethical failure. Non-ionizing radiation, such as radio waves or visible light, does not possess enough energy to ionize atoms and is generally considered to have lower biological risk in diagnostic imaging contexts. Misclassifying X-rays would lead to a failure to implement essential radiation safety protocols, potentially exposing patients and staff to unnecessary radiation doses, which directly contravenes the CAMET mandate for safe and effective practice. Furthermore, it would indicate a fundamental lack of understanding of the core principles of radiation physics, jeopardizing the integrity of diagnostic imaging procedures and patient well-being. Another incorrect approach might involve conflating the energy levels of different types of non-ionizing radiation without understanding the fundamental distinction from ionizing radiation. While some forms of non-ionizing radiation, like UV light, can cause biological effects, they do not do so through the ionization process that defines ionizing radiation. Failing to make this critical distinction means the technologist would not be applying the correct safety principles relevant to X-ray procedures. The professional reasoning process for similar situations should involve a systematic evaluation of the imaging modality being used. This begins with identifying the source of radiation, e.g., X-ray tube, MRI scanner, ultrasound transducer. Next, the technologist must recall or determine the fundamental properties of that radiation type, specifically whether it is capable of ionization. This knowledge then informs the selection of appropriate imaging parameters, the implementation of patient and staff protection measures, and the understanding of potential biological effects. Adherence to established protocols and continuous professional development in radiation physics are essential for maintaining competence and ensuring patient safety, as expected by the CAMET. Question 8. The control framework reveals a scenario where a patient undergoing a fluoroscopic examination exhibits involuntary movement due to discomfort, potentially compromising image quality and increasing radiation dose. What is the most appropriate immediate course of action for the medical radiation technologist to manage this risk? Option A. Proceed with the examination at the current settings, accepting the potential for suboptimal image quality and increased dose. Option B. Immediately terminate the fluoroscopic examination and reschedule the procedure for a later date. Option C. Significantly increase all imaging parameters, including KVP and M, to overcome the patient's movement and ensure image acquisition. Option D. Attempt to verbally coach the patient to remain still, reassess immobilization techniques if applicable, and adjust imaging parameters judiciously to maintain diagnostic quality while adhering to ALARA principles. The correct answer is D. Attempt to verbally coach the patient to remain still, reassess immobilization techniques if applicable, and adjust imaging parameters judiciously to maintain diagnostic quality while adhering to ALARA principles. Explanation. The control framework reveals a common implementation challenge in radiation safety, balancing the need for effective diagnostic imaging with the ALARA, as low as reasonably achievable, principle when faced with patient movement during a procedure. This scenario is professionally challenging because it requires the technologist to make an immediate, informed decision that impacts both image quality and radiation dose, without compromising patient care or violating regulatory standards. The technologist must consider the potential for repeat scans, increased patient dose, and the diagnostic utility of the images obtained. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic efficacy through a systematic, evidence-based decision-making process. It involves a thorough assessment of the situation, considering factors such as the patient's condition, the reason for the movement, and the potential impact on image interpretation. This approach aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Professional Conduct, which emphasizes the technologist's responsibility to provide safe and effective patient care and to minimize radiation exposure to patients and others. It also adheres to the principles of radiation protection as outlined in relevant Canadian federal and provincial regulations, which mandate the application of the ALARA principle. An incorrect approach that involves proceeding with the scan without attempting to mitigate the movement or reassess the imaging parameters would be professionally unacceptable. This failure to adapt to the patient's condition and the resulting suboptimal image quality could lead to the need for repeat imaging, thereby increasing the patient's radiation dose unnecessarily, which is a direct contravention of the ALARA principle. Furthermore, it demonstrates a lack of critical thinking and professional judgment in managing radiation exposure. Another incorrect approach, such as immediately aborting the procedure and rescheduling without considering alternatives, might be overly cautious and could delay necessary diagnostic information, potentially impacting patient outcomes. While patient safety is paramount, the decision to abort should be based on a comprehensive risk-benefit analysis, not an automatic response. This approach fails to explore all reasonable options to achieve diagnostic quality images with minimal dose. A third incorrect approach, such as increasing all imaging parameters indiscriminately to compensate for movement, is also professionally unacceptable. This is a brute force method that ignores the nuanced application of ALARA and could lead to excessive radiation dose without guaranteeing improved image quality, potentially introducing artifacts or overpenetration. It demonstrates a lack of understanding of how to optimize imaging parameters for specific situations. The professional reasoning process for similar situations should involve 1. Immediate assessment of the cause and severity of patient movement. 2. Consideration of the impact on diagnostic image quality. 3. Evaluation of potential strategies to mitigate movement, e.g., verbal coaching, repositioning, immobilization aids. 4. Reassessment of imaging parameters if necessary, applying ALARA principles. 5. decision-making based on a balance of diagnostic necessity, patient safety, and radiation protection. 6. Documentation of the decision-making process and any deviations from standard protocol. Question 9. To address the challenge of maintaining patient data integrity and privacy within a digital imaging and PACS environment, a medical radiation technologist observes several potential issues. The PACS system has been experiencing intermittent slow performance, and there are occasional alerts regarding disk space limitations. Additionally, a new administrative assistant has been hired and has inquired about accessing patient images to assist with record-keeping tasks. The technologist must determine the most appropriate course of action to ensure compliance with Canadian healthcare regulations and professional standards. Option A. Document the system performance issues and the request for access, and wait for IT to address the alerts before taking any further action regarding data security or access. Option B. Immediately implement a comprehensive data backup and recovery plan, establish role-based access controls for the PACS system, and provide targeted training to the administrative assistant on appropriate data handling procedures. Option C. Inform the administrative assistant that access to patient images is strictly prohibited and suggest they manually cross-reference patient files from paper records instead, while continuing to monitor the PACS performance without immediate intervention. Option D. Advise the administrative assistant that they can access the PACS system for record-keeping purposes as needed, and focus on addressing the system performance issues by increasing storage capacity. The correct answer is B. Immediately implement a comprehensive data backup and recovery plan, establish role-based access controls for the PACS system, and provide targeted training to the administrative assistant on appropriate data handling procedures. Explanation. Scenario analysis. This scenario presents a common challenge in modern medical imaging departments, ensuring the integrity and accessibility of digital imaging data while adhering to strict privacy and security regulations. The professional challenge lies in balancing the need for efficient workflow and data sharing with the paramount responsibility of protecting patient confidentiality and maintaining accurate diagnostic records. Mismanagement of PACS data can lead to significant patient safety risks, regulatory noncompliance, and erosion of public trust. Correct approach analysis. The correct approach prioritizes patient data security and regulatory compliance as mandated by Canadian healthcare legislation and professional standards. Implementing robust access controls, regular data backups, and adherence to established protocols for data transfer and archiving are fundamental to best professional practice. This aligns with the principles of patient privacy, data integrity, and the legal requirements for maintaining medical records, ensuring that only authorized personnel can access sensitive information and that data is preserved for clinical and legal purposes. Incorrect approach is analysis. Failing to implement regular, verified backups of PACS data is a significant regulatory and ethical failure. It directly contravenes the requirement to maintain accurate and accessible patient records, potentially leading to data loss and compromising patient care. It also violates principles of professional responsibility to safeguard patient information. Granting unrestricted access to the PACS system to all staff, regardless of their role or need to know, is a severe breach of patient privacy regulations. This indiscriminate access increases the risk of unauthorized viewing, modification, or disclosure of sensitive patient information, leading to potential legal repercussions and ethical violations. Ignoring system alerts regarding potential data corruption or security breaches demonstrates a disregard for patient safety and data integrity. This inaction can lead to irreversible data loss or compromise, directly impacting diagnostic capabilities and patient care, and failing to uphold the professional duty of care. Professional reasoning. Professionals should adopt a risk-based approach, continuously assessing potential threats to data security and patient privacy. This involves staying informed about relevant Canadian privacy legislation, e.g., PIPEDA, provincial equivalents, professional college guidelines, and best practices in digital imaging and PACS management. A proactive stance, including regular training, system audits, and clear protocols for data handling, is essential for maintaining a secure and compliant imaging environment. Decision-making should always be guided by the principles of patient confidentiality, data integrity, and the legal and ethical obligations of the profession. Question 10. Analysis of patient presenting with acute abdominal pain, where initial ultrasound has been inconclusive. The referring physician is requesting further imaging to identify the cause. The medical radiation technologist, MRT, is considering options including CT scan, MRI, and a repeat ultrasound with a different protocol. The MRT must select the most appropriate imaging modality, prioritizing patient safety and diagnostic accuracy while adhering to CAMET guidelines. Which approach best demonstrates responsible professional judgment in this scenario? Option A. Recommend a repeat ultrasound with the same protocol as before, as the initial study was inconclusive and further imaging might not yield different results. Option B. Proceed with a CT scan due to its speed and common use for abdominal imaging, without further consultation or detailed review of the patient's history beyond the initial request. Option C. Consult with the referring physician or a radiologist to discuss the patient's clinical presentation, review the previous ultrasound findings, and collaboratively determine the most appropriate imaging modality, considering radiation dose, patient contraindications, and diagnostic yield. Option D. Select the imaging modality that the MRT is most experienced with and has readily available, assuming it can provide adequate visualization. The correct answer is D. Select the imaging modality that the MRT is most experienced with and has readily available, assuming it can provide adequate visualization. Explanation: this scenario is professionally challenging because it requires the medical radiation technologist, MRT, to balance the diagnostic needs of the patient with the inherent risks associated with different imaging modalities, all within the strict regulatory framework of the Canadian Association of Medical Radiation Technologists, CAMET. The technologist must exercise sound professional judgment to select the most appropriate imaging modality, considering factors beyond just image quality, such as patient history, potential contraindications, and radiation dose. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic efficacy by adhering to established protocols and seeking expert consultation when necessary. This aligns with the CAMET ethical guidelines and the principles of responsible practice, which emphasize minimizing radiation exposure while achieving diagnostic goals. Consulting with the referring physician or a radiologist ensures that the chosen modality is not only technically feasible, but also clinically indicated and the safest option for the patient, reflecting a collaborative and patient-centered approach. An incorrect approach that relies solely on personal preference or readily available equipment without a thorough risk assessment fails to meet professional standards. This could lead to suboptimal imaging, unnecessary radiation exposure, or even harm to the patient, violating the ethical obligation to provide competent and safe care. Ignoring patient history or contraindications, such as a known allergy to contrast media or pregnancy, represents a significant regulatory and ethical failure, potentially resulting in adverse events and professional misconduct. Furthermore, proceeding with an imaging modality without understanding its specific risks and benefits for the individual patient demonstrates a lack of due diligence and a departure from best practices. Professional decision-making in such situations should involve a systematic process. First, thoroughly reviewing the patient's clinical information and the referring physician's request. Second, considering all available imaging modalities and their respective risks and benefits in the context of the patient's condition. Third, consulting with relevant healthcare professionals, e.g., radiologist, referring physician, to confirm the most appropriate and safest choice. And finally, documenting the decision-making process and the rationale for the chosen modality. Question 11. System analysis indicates that a computed tomography, CT scan of the abdomen reveals subtle streaking artifacts in the periphery of the image, particularly around bony structures. The technologist recognizes these as likely beam-hardening artifacts, which are common in CT imaging and generally do not obscure critical diagnostic information in this region. Considering the principles of radiation safety and diagnostic efficacy, what is the most appropriate course of action? Option A. Proceed with the scan and accept the image quality, as the artifacts are minor and unlikely to impact diagnostic interpretation. Option B. Immediately repeat the scan with adjusted parameters to eliminate the artifacts. Option C. Discard the current scan and re-image the patient from the beginning. Option D. Report the artifacts to the radiologist as a potential diagnostic concern without further assessment. The correct answer is A. Proceed with the scan and accept the image quality, as the artifacts are minor and unlikely to impact diagnostic interpretation. Explanation. Scenario analysis. This scenario presents a common challenge in computed tomography, CT, imaging where a technologist must balance image quality, patient safety, and diagnostic efficacy. Professional challenge lies in interpreting subtle image artifacts and understanding their potential impact on diagnosis, while also adhering to radiation safety principles and departmental protocols. The technologist must exercise critical judgment to determine the root cause of the artifact and the most appropriate course of action, without compromising the diagnostic value of the scan or unnecessarily increasing patient radiation dose. Correct approach analysis. The correct approach involves a systematic evaluation of the artifact, considering its appearance, location, and potential causes. This aligns with best professional practice as outlined by the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize the technologist's responsibility to provide high-quality diagnostic imaging while prioritizing patient well-being. Specifically, understanding the principles of CT physics and image formation allows the technologist to identify common artifacts such as beam hardening, motion, or metallic streak artifacts. By recognizing the artifact as a common, non-critical issue that does not significantly obscure diagnostic information and can be mitigated by post-processing or is inherent to the imaging process, the technologist demonstrates a commitment to efficient and effective patient care. This approach avoids unnecessary repeat scans, thereby minimizing radiation exposure and resource utilization, which are key ethical considerations in medical imaging. Incorrect approaches analysis. Repeating the scan immediately without further investigation is professionally unacceptable because it violates the principle of ALARA, as low as reasonably achievable, by unnecessarily increasing the patient's radiation dose. This action demonstrates a lack of critical thinking and problem-solving skills, failing to leverage knowledge of CT artifact types and their implications. It also represents a potential waste of departmental resources. Assuming the artifact is clinically significant and immediately escalating to the radiologist without attempting to identify the artifact type or its potential impact is also professionally unsound. While collaboration with the radiologist is crucial, the technologist has a responsibility to perform initial assessments and provide relevant information. This approach bypasses the technologist's role in image quality assessment and can lead to unnecessary interruptions in workflow and increased radiologist workload for issues that may not be clinically relevant. Ignoring the artifact and proceeding with image interpretation without any acknowledgement or attempt to understand its origin is professionally negligent. This failure to critically evaluate image quality can lead to misinterpretation of diagnostic information, potentially impacting patient diagnosis and treatment. It directly contravenes the CAMET commitment to providing accurate and reliable diagnostic images. Professional reasoning. When faced with image artifacts, medical radiation technologists should employ a structured decision-making process. This involves 1. Recognizing and identifying the artifact based on its visual characteristics and knowledge of CT physics. 2. Assessing the artifact's potential impact on diagnostic image quality and clinical interpretation. 3. Consulting departmental protocols and relevant literature for guidance on artifact management. 4. Determining the most appropriate course of action, which may include proceeding with the scan, adjusting parameters for a repeat scan if necessary and justified, or consulting with the radiologist. This systematic approach ensures that patient safety, image quality, and diagnostic accuracy are prioritized, aligning with professional ethical obligations and regulatory standards. Question 12. The efficiency study reveals that the average time spent per abdominal radiograph is exceeding the target benchmark. To improve throughput, a technologist considers slightly rotating the patient's supine position to achieve a quicker centering of the kidneys and spleen, even if it means the vertebral column is not perfectly perpendicular to the image receptor. This adjustment is made without consulting the radiologist or reviewing the established protocol for abdominal radiography. Which of the following approaches best upholds the professional responsibilities of a medical radiation technologist in this scenario? Option A. Adjust the patient's position to achieve faster centering, but ensure all abdominal organs are clearly delineated without significant distortion. Accepting a minor deviation from the standard protocol, Option B. Proceed with the adjusted positioning, prioritizing the reduced examination time to meet efficiency targets, assuming the kidneys and spleen are still adequately visualized. Option C. Maintain standard supine positioning, ensuring the vertebral column is perpendicular to the image receptor, and acquire the images according to the established protocol, even if it takes slightly longer. Option D. Immediately implement the adjusted positioning technique across all abdominal radiographs to standardize the new, faster workflow and inform colleagues of the change. The correct answer is B. Proceed with the adjusted positioning, prioritizing the reduced examination time to meet efficiency targets, assuming the kidneys and spleen are still adequately visualized. Explanation. Scenario analysis. This scenario presents a professional challenge where a technologist must balance the need for efficient workflow with the absolute requirement for accurate anatomical visualization for diagnostic purposes. The pressure to increase throughput can lead to compromises in image quality or patient positioning, directly impacting the diagnostic value of the radiograph and potentially leading to misdiagnosis or the need for repeat examinations. Adherence to established protocols and anatomical landmarks is paramount to ensure patient safety and diagnostic efficacy. Correct approach analysis. The correct approach prioritizes accurate anatomical representation by ensuring proper patient positioning and adherence to established radiographic protocols for the specific organ system being imaged. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize the technologist's responsibility to provide high-quality diagnostic images. Specifically, the CAMET practice standards for radiography mandate that technologists acquire images that demonstrate appropriate anatomical structures, free from significant artifacts, and with optimal technical factors. This approach ensures that the images are diagnostically useful, minimizing the risk of misinterpretation and unnecessary radiation exposure from repeat imaging. Incorrect approach is analysis. One incorrect approach involves reducing exposure time or altering patient positioning to expedite the examination, even if it compromises the visualization of critical anatomical landmarks. This violates the CAMET practice standards by failing to produce diagnostically adequate images. It can lead to suboptimal image quality, potentially obscuring pathology or normal anatomy, and may necessitate repeat imaging, thereby increasing patient radiation dose and decreasing departmental efficiency in the long run. Another incorrect approach is to rely solely on automated positioning systems without verifying the accuracy of the anatomical representation. While automation can improve consistency, it does not replace the technologist's critical judgment in ensuring that the specific anatomical structures of interest are correctly centered and demonstrated according to the radiographic protocol. Failure to verify can result in images that appear technically acceptable but lack the precise anatomical detail required for accurate diagnosis, contravening the CAMET emphasis on diagnostic quality. A third incorrect approach is to omit specific projections or views that are part of the standard protocol for a particular organ system, even if the technologist believes the initial images are sufficient. This bypasses established best practices designed to provide a comprehensive anatomical assessment and can lead to misdiagnoses. The CAMET practice standards require adherence to approved protocols unless there is a clear clinical justification and appropriate consultation, which is not implied in a general efficiency drive. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough understanding of the radiographic protocol for the specific examination. This involves identifying the key anatomical structures that must be visualized and the positioning requirements to achieve this. When faced with efficiency pressures, the technologist must critically evaluate whether any proposed shortcut will compromise diagnostic image quality. If there is any doubt, the technologist should consult with a radiologist or supervisor to determine the most appropriate course of action that balances efficiency with diagnostic integrity and patient safety, always prioritizing the CAMET ethical and professional standards. Question 13. What factors determine the optimal selection of exposure factors, KVPM as in distance, to achieve diagnostic image quality while adhering to radiation protection principles in X-ray imaging? Option A. Patient's physical characteristics, suspected pathology, and the specific imaging protocol. Option B. The technologist's personal preference for image appearance. Option C. the speed at which the examination can be completed. Option D, the maximum output capability of the X-ray equipment. Correct answer is A, patient's physical characteristics, suspected pathology, and the specific imaging protocol. Explanation: scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to balance the diagnostic needs of the patient with the principles of radiation protection, specifically minimizing patient dose while achieving diagnostic image quality. The technologist must make informed decisions about exposure factors based on a complex interplay of patient anatomy, pathology, and equipment capabilities, all within the framework of regulatory guidelines. This demands a deep understanding of X-ray physics and its practical application, as well as an ethical commitment to ALARA, as low as reasonably achievable. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's physical characteristics, e.g., body habitus, anatomical region, the suspected pathology, and the specific imaging protocol being used. This assessment directly informs the selection of appropriate exposure factors, KVP, M as distance, to optimize image quality and minimize radiation dose. Adherence to the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and relevant provincial/territorial radiation safety regulations is paramount. These regulations mandate that MRTs practice within their scope of practice, ensuring patient safety and diagnostic efficacy. The CAMET commitment to professional development and evidence-based practice further supports this approach, emphasizing the need for continuous learning and application of current best practices in X-ray imaging principles. Incorrect approaches analysis. One incorrect approach would be to solely rely on preset equipment protocols without considering individual patient variations. This fails to account for differences in patient size, tissue density, and the presence of pathology, potentially leading to underexposed or overexposed images, necessitating repeat exposures and increasing patient dose. This violates the principle of ALARA and the ethical obligation to provide optimal patient care. Another incorrect approach would be to prioritize speed of examination over image quality and dose optimization. This could involve using excessively high exposure factors to reduce exposure time, which can degrade image quality and unnecessarily increase patient dose. This disregards the fundamental X-ray imaging principles that govern the relationship between exposure factors, image receptor response, and diagnostic information. A third incorrect approach would be to ignore the patient's clinical history or suspected pathology when selecting exposure factors. The presence of certain conditions can significantly alter tissue attenuation, requiring adjustments to exposure factors to achieve diagnostic images. Failing to consider this can lead to diagnostic errors and compromise patient care, which is a failure to uphold professional responsibilities as outlined by regulatory bodies. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough review of the patient's requisition and clinical information. This is followed by an assessment of the patient's physical characteristics and the specific anatomical region to be imaged. The technologist then consults the appropriate imaging protocol, critically evaluating its suitability for the individual patient. Based on this comprehensive assessment, the technologist selects and adjusts exposure factors to achieve the best possible diagnostic image quality while adhering to the ALARA principle and all relevant regulatory requirements. This iterative process of assessment, selection, and optimization is crucial for safe and effective medical imaging practice. Question 14. The efficiency study reveals that a technologist is documenting the positioning for a chest X-ray to ensure clarity and accuracy for subsequent image review and potential repeat imaging. Which of the following descriptions best utilizes precise anatomical terminology and planes for the superior aspect of the left lung apex? Option A. The uppermost point of the left lung is aligned with the top of the image. Option B. The top of the left lung is centered in the upper portion of the image. Option C. The superior aspect of the left lung apex is positioned at the superior margin of the image receptor, just below the clavicle. Option D. The apex of the left lung is visualized at the superior aspect of the image, medial to the clavicle. The correct answer is C. The superior aspect of the left lung apex is positioned at the superior margin of the image receptor, just below the clavicle. Explanation. Scenario analysis. This scenario presents a challenge in accurately communicating patient positioning and anatomical landmarks during a diagnostic imaging procedure. Misinterpretation of anatomical terminology or planes can lead to incorrect image acquisition, potentially compromising diagnostic accuracy and requiring repeat procedures, which impacts patient care, radiation dose, and resource utilization. The technologist must demonstrate a precise understanding of anatomical references to ensure effective communication with colleagues and accurate documentation. Correct approach analysis. The correct approach demonstrates a thorough understanding of standard anatomical terminology and planes as applied in medical imaging. This ensures clear, unambiguous communication, which is fundamental to patient safety and diagnostic quality. Adherence to established terminology aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Practice Standards, which emphasize professional competence, patient well-being, and accurate record-keeping. Using precise terms like superior aspect of the left clavicle and anterior midline leaves no room for misinterpretation regarding the specific anatomical location and orientation. Incorrect approaches analysis. An approach that uses vague or colloquial terms like top of the shoulder or front of the chest is professionally unacceptable. This lacks the precision required for medical documentation and communication, increasing the risk of error and misinterpretation. It fails to meet the professional standard of accuracy expected by the CAMET and could lead to diagnostic errors or unnecessary radiation exposure if the incorrect area is imaged. An approach that incorrectly identifies the anatomical plane, for example, referring to a sagittal plane when a coronal plane is intended, is also professionally unacceptable. This demonstrates a fundamental misunderstanding of anatomical orientation and imaging principles. Such an error directly contravenes the CAMET emphasis on competence and accurate image acquisition, potentially leading to misdiagnosis or the need for repeat imaging. An approach that mixes anatomical terminology with non-standard or subjective descriptions, such as where the patient feels the most discomfort, is professionally unacceptable. Medical imaging relies on objective anatomical references, not subjective patient reporting for positioning. This approach introduces variability and potential for error, undermining the diagnostic integrity of the imaging procedure and failing to adhere to professional standards of objectivity and accuracy. Professional reasoning. Professionals should approach anatomical descriptions by consistently applying standardized terminology and understanding the three primary anatomical planes, sagittal, coronal, and transverse, and their relationship to the patient's body. When describing a location, it is crucial to be specific, referencing bony landmarks, anatomical structures, and their relative positions, e.g., superior, inferior, anterior, posterior, medial, lateral. In cases of uncertainty, consulting anatomical atlases, experienced colleagues, or imaging protocols is a best practice. This systematic approach ensures accuracy, promotes effective team communication, and upholds the highest standards of patient care and professional responsibility as mandated by the CAMET. Question 15. Regulatory review indicates that a medical radiation technologist is performing a fluoroscopic examination on a patient requiring prolonged imaging. To uphold radiation safety principles, which of the following actions best demonstrates compliance with the ALARA principle in this context? Option A. Increasing the fluoroscopic exposure rate to expedite the examination and reduce the overall time the beam is on. Option B. Performing the examination without any additional shielding for staff, as the patient's condition requires immediate attention. Option C. Reducing the fluoroscopic exposure factors significantly to minimize patient dose, even if it compromises the diagnostic quality of the images. Option D. Utilizing the lowest possible fluoroscopic exposure rate and pulsed fluoroscopy where appropriate, while ensuring adequate image quality for diagnosis and employing appropriate shielding for staff. Correct answer is D. Utilizing the lowest possible fluoroscopic exposure rate and pulsed fluoroscopy where appropriate, while ensuring adequate image quality for diagnosis and employing appropriate shielding for staff. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology, balancing the need for diagnostic imaging with the imperative to minimize radiation exposure to both patients and staff. The professional challenge lies in interpreting and applying the ALARA principle in a practical, real-world setting, where patient condition and imaging requirements may conflict with strict adherence to dose reduction. This requires careful judgment, an understanding of the specific imaging modality, and knowledge of the relevant regulatory guidelines. Correct approach analysis. The correct approach, which involves optimizing imaging parameters to achieve the diagnostic objective while employing shielding and minimizing exposure time, directly aligns with the core tenets of radiation safety as mandated by Canadian regulatory frameworks for medical radiation technologists. The principle of ALARA, as low as reasonably achievable, is paramount. This approach prioritizes patient care by ensuring diagnostic image quality is maintained, while simultaneously demonstrating a commitment to radiation protection through the judicious use of shielding and time. This reflects best professional practice by integrating technical proficiency with ethical responsibility. Adhering to the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and relevant provincial/federal radiation safety regulations. Incorrect approaches analysis. One incorrect approach would be to prioritize speed of examination over dose reduction, potentially leading to unnecessary radiation exposure. This fails to uphold the ALARA principle and could violate regulatory requirements for dose optimization. Another incorrect approach would be to excessively reduce exposure factors to the point where diagnostic image quality is compromised, leading to repeat examinations and thus increasing overall patient dose. This demonstrates a misunderstanding of the balance required by ALARA and a failure to meet the primary objective of providing diagnostic information. A third incorrect approach might involve neglecting to use appropriate shielding for staff or other individuals in the vicinity, which directly contravenes regulations concerning occupational radiation protection and the principle of minimizing dose to all individuals. Professional reasoning. Medical radiation technologists must employ a systematic decision-making process when faced with radiation safety considerations. This process begins with a thorough understanding of the examination protocol and the patient's clinical indication. Next, they must assess the potential for radiation exposure to the patient and themselves, identifying opportunities for dose reduction through technique optimization, appropriate collimation, and the use of shielding. Finally, they must critically evaluate the image quality to ensure diagnostic adequacy, recognizing that repeat exposures increase overall dose. This iterative process, guided by regulatory requirements and ethical principles, ensures that patient care is delivered safely and effectively. Question 16. The audit findings indicate a pattern of inconsistent adherence to shielding protocols during fluoroscopic procedures, with some technologists occasionally deviating from prescribed lead apron and thyroid shield usage. Considering the potential for stochastic effects, including genetic mutations, what is the most appropriate immediate professional response for a certified medical radiation technologist? Option A. Initiate a review of the audit findings to determine the frequency and nature of protocol deviations, assess potential dose implications for patients and staff, and consult relevant CAMET guidelines and Canadian radiation safety regulations to implement targeted corrective actions. Option B. Immediately implement a mandatory retraining program for all staff on radiation safety principles, without first investigating the specific causes of the audit findings or assessing the actual dose implications. Option C. Assume the deviations were minor and did not result in doses significant enough to cause heritable genetic damage, and therefore no further action is required beyond a verbal reminder to staff. Option D. Focus solely on improving image quality and reducing patient procedure times, as these are the primary metrics for audit success, and address shielding issues only if directly linked to immediate patient harm. Correct answer is A. Initiate a review of the audit findings to determine the frequency and nature of protocol deviations, assess potential dose implications for patients and staff, and consult relevant CAMET guidelines and Canadian radiation safety regulations to implement targeted corrective actions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the technologist to interpret audit findings related to radiation safety protocols and their potential impact on genetic effects, a long-term and often subtle consequence of radiation exposure. The challenge lies in translating abstract audit observations into concrete actions that uphold patient and public safety. Adhering strictly to the Canadian Association of Medical Radiation Technologists, CAMET, standards, and relevant Canadian federal and provincial radiation safety regulations. The technologist must demonstrate a deep understanding of radiation biology and regulatory compliance. Correct approach analysis. The correct approach involves a thorough review of the audit findings in the context of established radiation safety principles and regulatory requirements. This includes assessing whether the identified deviations from protocol could have led to doses that increase the risk of stochastic effects, such as genetic mutations. Best professional practice, as guided by CAMET certification standards and Canadian regulatory bodies like Health Canada's Radiation Protection Bureau, mandates a proactive and evidence-based response. This means investigating the root cause of the deviations, evaluating the potential dose implications, and implementing corrective actions to prevent recurrence, thereby minimizing any potential for heritable genetic damage. This aligns with the ALARA, as low as reasonably achievable, principle, which is a cornerstone of radiation protection in Canada. Incorrect approaches analysis. One incorrect approach would be to dismiss the audit findings as minor procedural oversights without considering their potential biological implications. This fails to meet the ethical and professional obligation to protect individuals from unnecessary radiation exposure, including the risk of genetic effects, as stipulated by CAMET ethical guidelines and Canadian radiation safety legislation. Such an approach demonstrates a lack of understanding of stochastic effects and a disregard for the precautionary principle. Another incorrect approach would be to focus solely on immediate patient outcomes and ignore the long-term genetic implications for future generations. Canadian radiation protection regulations emphasize the protection of both individuals and populations, and this includes considering the potential for heritable genetic damage. Ignoring this aspect represents a significant failure in professional responsibility and regulatory compliance. A third incorrect approach would be to implement corrective actions without a proper investigation into the cause of the audit findings. This reactive measure, while seemingly addressing the issue, does not guarantee that the underlying problem contributing to potentially increased doses will be resolved, leaving the risk of future genetic effects unmitigated. Effective radiation safety management, as expected by CAMET and Canadian regulators, requires a systematic approach to problem solving. Professional reasoning. Professionals should approach such situations by first understanding the specific audit findings and their relation to radiation dose. They must then consult relevant CAMET standards, provincial/territorial radiation safety regulations, and federal guidelines from Health Canada. A systematic investigation into the cause of any identified deviations is crucial. This should be followed by an assessment of the potential radiation doses received and their associated risks, particularly concerning stochastic effects like genetic mutations. Finally, the implementation of targeted, evidence-based corrective actions, with a focus on preventing recurrence and ensuring ALARA, is paramount. Continuous professional development in radiation biology and safety is also essential. Question 17. The efficiency study reveals a pattern of slightly elevated radiation doses in a specific imaging protocol, accompanied by a statistically insignificant but noticeable increase in reported minor skin irritations among patients undergoing this protocol over the past year. What is the most appropriate course of action for the medical radiation technologist? Option A. Focus solely on optimizing image acquisition parameters to improve diagnostic clarity, disregarding the observed dose elevation and skin irritations as separate issues. Option B. Recommend increasing the imaging frequency for these patients to monitor for any potential long-term effects, assuming the current dose is acceptable. Option C. Document the findings but consider the skin irritations as coincidental and unrelated to the radiation dose, as the increase is not statistically significant. Option D. Initiate a review of the imaging protocol, focusing on dose reduction techniques and potential biological implications of the observed radiation levels, while consulting with senior technologists and radiologists. The correct answer is D. Initiate a review of the imaging protocol, focusing on dose reduction techniques and potential biological implications of the observed radiation levels, while consulting with senior technologists and radiologists. Explanation. Scenario analysis. This scenario presents a professional challenge by requiring the technologist to interpret observed patient outcomes in the context of radiation biology and to consider potential systemic issues beyond individual technique. The challenge lies in moving beyond a simple assessment of image quality to understanding the underlying biological implications of radiation exposure and how these might manifest in patient health, even if not immediately apparent. This necessitates a deep understanding of radiation biology principles and their practical application in diagnostic imaging. Correct approach analysis. The correct approach involves recognizing that observed patient outcomes, even if subtle or delayed, could be linked to cumulative radiation exposure and its biological effects. This aligns with the ethical and professional responsibility of medical radiation technologists to minimize patient dose while maintaining diagnostic image quality, as mandated by principles of radiation protection and patient safety. It reflects a proactive stance in identifying potential issues that could impact patient well-being, prompting further investigation and adherence to ALARA, as low as reasonably achievable, principles. This approach prioritizes patient safety and continuous quality improvement by linking technical practice to biological consequences. Incorrect approaches analysis. One incorrect approach would be to dismiss the observed outcomes as unrelated to radiation exposure without further investigation. This fails to acknowledge the stochastic and deterministic effects of radiation, which can manifest in various ways, including long-term health impacts. Ethically, this approach neglects the technologist's duty of care and the fundamental principle of minimizing harm. It also bypasses the opportunity for quality improvement and adherence to regulatory guidelines that emphasize dose optimization. Another incorrect approach would be to focus solely on image quality metrics without considering the associated radiation dose. While image quality is crucial for diagnosis, it should not be pursued at the expense of unnecessary radiation exposure. This approach disregards the biological risks associated with higher doses and violates the ALARA principle. It represents a failure to integrate the understanding of radiation biology into daily practice, leading to potential patient harm. A third incorrect approach would be to attribute the outcomes solely to patient-specific factors without considering the role of radiation. While individual radiosensitivity varies, the technologist's role includes ensuring that radiation doses are optimized for all patients. Ignoring the potential contribution of radiation exposure to observed outcomes is a dereliction of professional responsibility and a failure to uphold the standards of practice expected by the Canadian Association of Medical Radiation Technologists. Professional reasoning. Professionals should approach such situations by first acknowledging the potential link between radiation exposure and patient outcomes, drawing upon their knowledge of radiation biology. They should then systematically evaluate the imaging procedures performed, considering dose levels and technique factors. This evaluation should be followed by consultation with relevant colleagues or supervisors to discuss findings and determine appropriate action, which may include protocol review, equipment assessment, or further patient follow-up if indicated. This process ensures a comprehensive and responsible approach to patient care, prioritizing safety and adherence to regulatory and ethical standards. Question 18. The performance metrics show a consistent trend of increased noise levels and reduced contrast resolution in digital radiography images across multiple examination types, exceeding the established acceptable limits for the past week. Option A. Immediately adjust the exposure factors and post-processing parameters for all imaging protocols to compensate for the perceived degradation in image quality. Option B. Assume the variations are within acceptable tolerance for routine workflow and continue with daily imaging procedures, monitoring for any further significant changes. Option C. Initiate a thorough review of the equipment's technical performance logs, consult the manufacturer's troubleshooting guide for noise and contrast issues, and report the findings to the medical physicist and imaging supervisor for further investigation and potential service. Option D. Focus on retraining technologists on optimal positioning techniques, as this is the most likely cause of reduced contrast resolution. The correct answer is C. Initiate a thorough review of the equipment's technical performance logs, consult the manufacturer's troubleshooting guide for noise and contrast issues, and report the findings to the medical physicist and imaging supervisor for further investigation and potential service. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology, identifying and addressing subtle but potentially significant deviations in image quality that could impact diagnostic accuracy and patient care. The challenge lies in distinguishing between minor, acceptable variations and those that indicate a systemic issue requiring immediate intervention. A technologist must balance the need for efficient workflow with the paramount responsibility of ensuring diagnostic quality, adhering to established protocols and regulatory requirements. This requires a keen understanding of imaging physics, equipment performance, and the specific quality assurance standards mandated by the Canadian Association of Medical Radiation Technologists, CAMT, and relevant provincial regulatory bodies. Correct approach analysis. The correct approach involves a systematic and evidence-based response to the observed performance metrics. This aligns with the CAMT emphasis on maintaining high standards of practice through robust quality assurance programs. Specifically, it requires the technologist to 1. Meticulously review the specific metrics that are outside the established acceptable ranges. 2. Consult the equipment's technical manual and the facility's QA protocols to understand the expected performance parameters and troubleshooting steps. 3. Document the findings thoroughly. And 4. Communicate the concerns to the appropriate personnel, e.g., supervisor, physicist, service engineer, for investigation and corrective action. This methodical process ensures that potential equipment malfunctions or protocol deviations are identified and addressed promptly, thereby safeguarding diagnostic image quality and patient safety, which are core ethical and professional obligations under CAMT guidelines. Incorrect approaches analysis. Ignoring the deviations or attributing them solely to minor fluctuations without further investigation is a significant regulatory and ethical failure. This approach violates the principle of due diligence in patient care and quality assurance. It suggests a disregard for established QA protocols, which are designed to prevent diagnostic errors and ensure consistent image quality. Such an action could lead to misdiagnosis, unnecessary repeat procedures, and increased radiation exposure to patients, all of which are contrary to the ethical standards promoted by CAMT and provincial regulatory bodies. Assuming the deviations are due to user error, without a systematic review of equipment performance and established protocols, is also professionally unacceptable. While user technique can influence image quality, a responsible technologist would first rule out equipment-related issues or protocol drift through objective QA measures before solely blaming user performance. This approach bypasses the essential steps of equipment verification and protocol adherence, potentially masking underlying technical problems and unfairly attributing blame. Implementing corrective actions without proper documentation or consultation with qualified personnel, e.g., physicist, service engineer, is another critical failure. Unilateral adjustments to equipment settings or protocols without understanding the root cause or seeking expert advice can exacerbate existing problems, compromise image quality further, or even lead to equipment damage. This deviates from the collaborative and evidence-based approach to problem solving expected in a regulated healthcare environment, and fails to meet the documentation and reporting requirements often mandated by regulatory bodies. Professional reasoning. Professionals facing such a situation should employ a structured decision-making framework. First, they must recognize and acknowledge the observed deviation from expected performance. Second, they should consult relevant resources, including equipment manuals, facility QA policies, and professional guidelines, e.g., CAMT standards. Third, they must gather objective data to understand the nature and extent of the deviation. Fourth, they should collaborate with appropriate colleagues or specialists to diagnose the issue. Fifth, they must implement evidence-based corrective actions and verify their effectiveness. Finally, all steps, findings, and actions must be meticulously documented. This systematic approach ensures accountability, promotes continuous improvement, and upholds the highest standards of patient care and professional practice. Question 19. Stakeholder feedback indicates that some medical radiation technologists, MRT, are encountering challenges in recognizing and responding to subtle signs of cardiovascular compromise during diagnostic imaging procedures. A patient undergoing a CT scan for suspected pulmonary embolism begins to exhibit a gradual decrease in blood pressure, a slight increase in heart rate, and reports feeling a bit lightheaded and clammy. The technologist observes pallor and a slight coolness to the patient's extremities. Based on your understanding of cardiovascular physiology and the regulatory framework governing MRT practice in Canada, what is the most appropriate immediate action for the technologist to take? Option A. Immediately stop the scan. Assess the patient's vital signs more thoroughly. and notify the supervising physician or appropriate medical team of the observed changes and the patient's subjective complaints. Option B. Administer oxygen to the patient and monitor their vital signs without informing the physician until the scan is completed. Option C. Continue the CT scan as planned, as the patient's symptoms are mild and may resolve on their own, and document the observations in the patient's chart. Option D. Ask the patient to take deep breaths and try to relax, assuming the symptoms are due to anxiety related to the procedure. The correct answer is A. Immediately stop the scan, assess the patient's vital signs more thoroughly, and notify the supervising physician or appropriate medical team of the observed changes and the patient's subjective complaints. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical radiation technologist, MRT, to interpret subtle physiological changes in a patient experiencing a potential cardiovascular compromise during an imaging procedure. The technologist must balance the need to acquire diagnostic images with the immediate imperative to recognize and respond to signs of distress, which could be life-threatening. This demands a high level of clinical observation, understanding of cardiovascular physiology, and the ability to act decisively within their scope of practice and established protocols. Correct approach analysis. The correct approach involves recognizing the patient's symptoms as indicative of reduced cardiac output and potential hypoperfusion. This understanding stems directly from knowledge of cardiovascular physiology, specifically how changes in heart rate, blood pressure, and peripheral circulation manifest. Promptly notifying the supervising physician or appropriate medical team allows for timely intervention, which is paramount in preventing further deterioration and ensuring patient safety. This aligns with the Canadian Association of Medical Radiation Technologists, CAMET, Code of Ethics and Standards of Practice, which emphasize patient well-being, professional responsibility, and the duty to report significant changes in a patient's condition. Incorrect approaches analysis. One incorrect approach is to continue the imaging procedure without immediate escalation. This fails to acknowledge the urgency of the patient's symptoms and prioritizes image acquisition over patient safety. It demonstrates a lack of understanding of the physiological implications of the observed signs and a failure to adhere to the fundamental ethical obligation to prevent harm. This could be considered a breach of professional duty of care. Another incorrect approach is to solely rely on the patient's verbal reassurance without further objective assessment or notification. While patient self-reporting is important, it should not override objective clinical signs of distress. Cardiovascular compromise can be insidious, and a patient may not fully comprehend the severity of their condition. This approach neglects the technologist's responsibility to critically evaluate the situation and act on observable physiological data. A third incorrect approach is to administer medication without explicit physician orders. This is a significant breach of scope of practice and regulatory guidelines for MRTs in Canada. While understanding physiology is crucial for recognizing problems, the intervention phase is strictly governed by physician direction and established protocols. Unauthorized administration of medication constitutes professional misconduct and could have severe legal and ethical ramifications. Professional reasoning. Professionals should employ a systematic approach to patient assessment. This involves 1. Initial observation of the patient's baseline status. 2. Continuous monitoring for any deviations from the baseline, paying close attention to vital signs and subjective complaints. 3. Applying knowledge of physiology to interpret observed signs and symptoms. 4. Following established protocols for escalating care when a patient's condition changes significantly. 5. Communicating clearly and concisely with the medical team. This structured decision-making process ensures that patient safety remains the highest priority while adhering to professional and regulatory standards. Question 20. Market research demonstrates that while the Gray GI is the standard C unit for absorbed dose in medical imaging and radiation therapy, some legacy equipment or older literature may still reference the Roentgen R for radiation exposure. Furthermore, the Sievert SV is critical for radiation protection. In a clinical scenario involving a patient undergoing a diagnostic imaging procedure where the dose is reported in Roentgens and a radiation worker's exposure is being monitored, which approach best reflects current Canadian regulatory requirements and professional best practices for medical radiation technologists. Option A. Primarily rely on the Roentgen unit for all radiation measurements, as it is a fundamental unit of radiation, and assume the sievert is an unnecessary complication for routine clinical practice. Option B. Treat the Roentgen and Gray as equivalent units for absorbed dose, as they both measure radiation quantity, and apply the same conversion factor for radiation worker monitoring. Option C. Accurately convert the Roentgen measurement to Gray's for absorbed dose assessment, and use the sievert for radiation protection considerations, recognizing the distinct applications of each unit as per Canadian guidelines. Option D. Use the Gray unit for both patient dose and radiation worker monitoring, disregarding the Roentgen and sievert as outdated or irrelevant in modern Canadian medical radiation technology. The correct answer is C. Accurately convert the Roentgen measurement to Gray's for absorbed dose assessment, and use the sievert for radiation protection considerations, recognizing the distinct applications of each unit as per Canadian guidelines. Explanation. Scenario analysis. This scenario presents a common challenge in medical radiation technology where different units of measurement for radiation dose are encountered. The professional challenge lies in accurately interpreting and applying these units in a clinical context, ensuring patient safety and diagnostic accuracy, while adhering to established Canadian regulatory standards. Misunderstanding or misapplication of these units can lead to incorrect treatment planning, inadequate shielding, or inaccurate reporting of radiation exposure, all of which have significant implications for patient care and regulatory compliance. Correct approach analysis. The correct approach involves understanding that the Gray JI is the C unit for absorbed dose, representing the energy deposited per unit mass of material, and is used for describing the dose delivered to tissues. The sievert SV is the C unit for equivalent dose and effective dose, accounting for the biological effectiveness of different types of radiation and the sensitivity of different organs, respectively. This distinction is crucial for radiation protection and risk assessment. The Roentgen R is an older unit for exposure, measuring the ionization produced in air, and while historically significant, it is largely superseded by the Gray in modern clinical practice for absorbed dose. A professional in Canada, working under the framework of the Canadian Association of Medical Radiation Technologists, CAMT, and relevant provincial regulatory bodies, must prioritize the use and understanding of C units, JI and SV, as mandated by current radiation safety legislation and guidelines. This ensures consistency, facilitates international comparison, and aligns with the most up-to-date scientific understanding of radiation effects. Incorrect approaches analysis. Confusing the Gray with the sievert without considering the biological weighting factors is a significant regulatory and ethical failure. While both relate to radiation dose, the sievert incorporates biological risk, making it the appropriate unit for assessing stochastic effects and setting dose limits for radiation workers and the public. Using the Gray alone when biological risk assessment is required, or vice versa, leads to an incomplete or inaccurate understanding of the potential harm. Equating the Roentgen directly to the Gray without acknowledging the conversion factors in the specific context, e.g., air kerma vs. absorbed dose in tissue, is also a failure. The Roentgen measures ionization in air, whereas the Gray measures energy absorbed in a specific material. While related, they are not interchangeable without proper context and conversion, and relying solely on the Roentgen for clinical dose assessment is outdated and non-compliant with current Canadian standards that emphasize C units. Furthermore, assuming all radiation measurements are equivalent regardless of the unit used demonstrates a lack of fundamental knowledge and a disregard for the precision required in radiation safety and dosimetry, which is a direct contravention of professional competency standards set by the CAMT and provincial licensing bodies. Professional reasoning. Professionals should adopt a systematic approach when encountering different units of radiation measurement. First, identify the specific unit being used and its definition, e.g., absorbed dose, equivalent dose, exposure. Second, determine the context of its use, e.g., diagnostic imaging, radiation therapy, radiation protection. Third, consult current Canadian regulatory guidelines and professional standards, e.g., Health Canada, provincial regulatory authorities, CAMT guidelines, to ascertain the preferred or mandated units for that specific application. Fourth, if older units are encountered, understand the appropriate conversion factors and limitations, prioritizing the use of C units, JI and SV, whenever possible for clinical dose assessment and radiation protection. This decision-making process ensures accurate interpretation, safe practice, and compliance with all applicable regulations.